are in listen-only mode.
Good afternoon everyone, and welcome to this afternoon's webinar on Get Healthy at Work. Some of you might be just finishing up your healthy lunches, I hope. So we'll just be holding for another minute while the rest of our guests log in. Good afternoon. As I said, we've waited for our stragglers to come into our first Get Healthy at Work webinar for the year. My name's Karina Anderson, and I'm the Marketing and Communications Manager for this new free workplace health service. And I'm really pleased that we've got so many people joining us this afternoon, I should say. Before we get started, I'll just run through some housekeeping. Now, for those of you who are new to webinars, we've got a couple of handy hints we'd like to go through before we start. So you should be able to see the slides on your screen now. If you can't see the slides or experience other technical issues, we'd suggest closing any other applications you've got open like Excel or Outlook, and that should immediately improve your performance. If this doesn't work, contact the GoToWebinar helpline, and you can see the number. It's 1-800-356-792. If your audio is poor, we really suggest using the telephone option. Now you should be able to see this control panel in the top right-hand corner of your screen. If you're a Mac user, it'll look a little bit different. But if your audio is poor or breaking up, use the telephone option to listen. To do this, just click on the button that says telephone. You'll see a telephone number to call, as well as an access code and audio pin. We would love today's webinar to be as interactive as possible, although I will let you know that you're all actually on mute. But if you do have a question, we will do our best to get to as many of them as possible. You can see here where you can type in your question, and we'll answer those at set pause moments throughout the presentation. Finally, some frequently asked questions, and these ones we get all the time. After today's presentation, you'll receive an email. In that email, you'll receive a copy of the slides. You'll also receive a recording of the slides of the presentation. But if you do have any questions, or if I'm not able to answer your question throughout the duration of the webinar, email GHAW, which is Get Healthy at Work, feedback at workcover.nsw.gov.au. Otherwise, go to the Get Healthy at Work website and fill out the feedback form, or call 13 10 50. But don't worry about having to write that down now. Those details will be made available at the end of the webinar as well. So let's get started. Over the next hour, I'll be taking you through why the New South Wales Government has invested $12 million over the next 2 years in making our state's workplaces healthier. I'll convince you there's no better time than now for your business to make a commitment to improving health, and January is particularly good timing. I'll introduce you to Get Healthy at Work. So this is really taking you, I guess, into a bit more detail, looking at the tools and resources and support that you're able to register for at the website. And that's all about helping you build a simple yet effective workplace health program. Finally, I'll do a short registration exercise through the website and demonstrate some other features and take more questions at the end. So why has the government given WorkCover and New South Wales Health $12 million to improve workplace health over the next 2 years? I guess coming from WorkCover, we certainly know organisations are familiar with health from a work health and safety perspective, but I think you'd all agree traditionally the focus has been more on safety rather than health, and this investment looks to, I guess, look at, rebalance that. Next, this investment aims to really empower workplaces to improve the health of their workers, and they'll do that by reducing the prevalence of chronic disease by combating modifiable risk factors. So by chronic disease, I'm really talking about things like type 2 diabetes, heart disease, some types of cancers, and looking at those modifiable risk factors, poor nutrition, low levels of physical activity, smoking, harmful alcohol use, and weight management. Those are really, I guess, the 5 risk factors which we see can have a really important role if we're able to turn those around in how we'll drive down chronic disease. So why from the health perspective? Well, chronic disease is the main cause of death and disability in the world, in this country and in this state. So much so that the New South Wales State Plan, so in 2021 they've got some really ambitious targets about reducing smoking rates even further than what the progress that's already been made over the last decade. Looking at obesity rates, which we know are climbing, and risk drinking. The state plan wants to really bring that right down. Next up, some I guess frightening stats of where we're sitting right now. Well, 2 years ago anyway, 60% of Australian adults were classified as overweight or obese. We know that's going up and up. Around 1 in 3 working age Australians have at least one chronic disease, so that's, as I said, type 2 diabetes, heart disease, things like that. 96% of us, so basically everyone, has at least one chronic disease risk factor. And I guess I can even expand on that. In that, 72% of us have multiple chronic disease risk factors. So certainly from a health perspective, there's a lot that we can do if workplace health improvements are made. Why workplaces? Well, you and I and every other working Australian probably knows we spend a lot of our time at work. About 1/3 of our life is spent at work, which makes me a little bit sad at times. 60% of adults in New South Wales are in the workforce, and undeniably workplace factors have a significant impact on the health of workers and in turn their families and our communities. Thinking about workplace factors, those are things like the actual physical environment. It could be the company culture. Perhaps lots of people work through lunch, or you start very early and finish very late. And then that very nature of work tasks. So if you're sitting at a computer all day, or even doing something very highly repetitive, all those kind of factors can really influence our health. So why from the business perspective? Well, you know, we've got here that we need to improve our health and we spend a lot of time at work, but why is it a business's, you know, why should a business take something like this on? First up, I guess in the short term there's some fantastic benefits, and in the long term you'll see those get even better. Within, I guess, the space of 6 to 12 months, if you invested in workplace health, you're looking at your team cohesion improving, worker morale improving, and that big one, employee engagement. Those things are all going to be enhanced in quite a short period of time. Looking at 1 to 2 years, things like your staff attraction and retention, job satisfaction, individual performance and corporate image will all improve, but a big one here is around productivity. Now, it was probably about a decade ago that the first real meaty studies around this were done, and back then that they found that healthy workers are actually 3 times more productive than unhealthy workers, and there's actually a swathe of research that's been done since, but I think that statistic still, from my mind, really stands out. Finally, in the longer term, you're looking at things like absenteeism and presenteeism drop. Presenteeism, I'm sure you're all familiar with absenteeism, but presenteeism is around this idea of people being at work, but they're not necessarily healthy. They're not necessarily able to do the job and the tasks that have been laid out for them. So they're there, but you're not really getting the productivity and efficiency out of that worker that you would if they were healthy. Another one here, return on training and development investment. And this last one, I guess, is really interesting, again, coming from a work cover perspective, is this workplace injuries and claims. Now, if safety is a priority for your organisation, that relationship is quite interesting, and in the UK, I think it was quite recently there was a study done that found that organisations that invest in workplace health programs report, I think it's a 50% reduction in injury rates and claims, which is quite stunning. I'd just like to quickly expand on that one a little bit, because our program launched about 6 months ago, and before that I was doing some research actually when I was getting ready for the job interview, and I found this fantastic story. Again, it's from the UK, but it was published probably around 2012 when the London Olympics were on. Now, as you know, if you're in Sydney at the time, there was a lot of construction work going on, and that was the same in London. There were 12,000 workers hired on construction of some of the major work sites. Now, that organisation, they were called the London Olympic Delivery Authority, decided to look at the health of their workers. What they found was quite startling. They found that 28% were obese, 41%, this is speaking of 12,000 people, 41% were overweight, 29% of workers had high blood pressure, and accidents peaked in the 1 hour before lunch. Now, they put a lot of this down into the nutrition of their workers. They were eating a lot of, they called it, there was a takeaway culture at the time, and so they just thought, as part of a workplace health program, what was something that they could do that would be very simple, not too costly, but potentially have a big impact on addressing, I guess, the health concerns of workers, but also the safety concerns for both the workers and the organisations. Looking at those accidents peaking in the 1 hour before lunch, when people were losing their concentration, they were feeling hungry, their sugar levels were dropping. So what they decided to do was introduce 1 pound porridge. So each morning, and you can imagine London's very grey and cold and wet, well, that's how I imagine it anyway, workers would rock up to the work site quite early. There they would be greeted by food trucks that were, for £1 they could hand over their cash and get a steaming warm bowl of porridge, which would actually, I guess, fuel them throughout the morning, providing them with something that was whole grain, nutritious, and low GI. Now, I'm not going to say this was all because of porridge, but certainly porridge played a part. Lawrence Waterman, who was the head of health and safety for the London Olympic Delivery Authority, said the result was better diets, lower accident rates, and a general boost to health. Our health and safety record is excellent, with 125 reportable injuries across more than 80 million man-hours worked. 80 million man-hours and just 125 injuries. The best ever achieved on a major UK construction project. So look, as I said, this case study really captured my imagination, and if safety is a priority for your organisation, I hope it captures yours as well. At the end of the day, most businesses will have two key drivers for looking at a workplace health program. The first one is very obvious, that work health and safety perspective, which is really looking at the safety, health and welfare of people engaged in work. The second one is this human capital, and this is where a lot of, I guess, innovative and industry-leading companies are approaching it from, looking at talent attraction and retention, corporate social responsibility, as well as productivity. So identifying which one of those is going to be the major motivator for your organisation is really key if you have to build a business case and get some leadership on board to invest in health. So have a think about that. One more thing I'd like you to think about is your return on investment. I know ROI is absolutely front of mind for a lot of people holding the purse strings. Some good news, and again there's lots of different figures here, and I've tried to go for one that was really quite conservative, but for every dollar invested in workplace health and wellbeing programs, a 2008 report in Australia found there was a return on investment of between $3 and $6. So again, in terms of building your business case, it's really important to keep in mind. So I'll actually stop here and see whether there's any questions.
Sure, so we've only had a couple of questions come through so far. The first was from David, who has asked, can you provide links to the studies underpinning this presentation?
Yeah, absolutely.
Yeah, absolutely.
At the end of
the presentation, you'll receive that email.
And in that email,
there'll be a PDF there called Building a Business Case for Get Healthy at Work, and all the statistics I've just referred to will be in that presentation.
Okay, and we have one other question here from Erin, who has asked if this program is available for state government organisations to participate in.
Good question, Erin.
Good question, Erin. Yes, it's available for all New South Wales workplaces.
However,
local government, any government sector workplace not currently eligible to request a service provider. Now, I'll probably expand on this a little bit later in the presentation, but basically we have about 15 service providers across the state who can work with organisations free of charge as part of the service to develop their workplace and face-to-face help to workers, but currently government sector workplaces aren't able to access that support. They can, however, complete the workplace health program using all the training tools and resources on the website, and we have got a fantastic online brief health check which mirrors the face-to-face one. So in terms of access to the program, absolutely, you're just not able to access a service provider to support you. So at that point we'll move on, and I'll introduce you to Get Healthy at Work in a bit more detail. I'll start off by looking at, I guess, the aim of the program, the health focus areas, and a service overview where I just explained a little bit about service providers then and what they can help you with, but I'll go into a little bit more detail. Next up, we'll look at the program cycle. So I think there's 5 steps. Sorry, we'll get there, and I'll probably find out that there's 6, but it's 5 steps. And looking at, I guess, the tools and resources and training that has been developed to help you along each step of the way. Finally, how to register. We'll get online and I'll walk you through that process. And using the website. So once you've registered, you go through to your business account portal, and I'll show you how to do things like how to fire off online health checks, add new users, and access all the resources and training that I'll introduce you to. So Get Healthy at Work. Get Healthy at Work was developed in partnership between New South Wales Health and WorkCover New South Wales, and it's really about giving businesses everything they need to develop, implement, monitor and review a simple, effective and sustainable workplace health program. It can be as detailed or as simple as you like, and that's really up to the individual business to tailor the program and the resources to its needs. I won't show you a video at this point because I think our bandwidth really struggles, but I'd encourage you to visit our website, and there's some videos on there, one for employers, one that I'd invite you to share with workers, and one if you're in work health and safety or human resources. You can also get onto our YouTube channel and access those, but they really are fantastic in terms of giving you an overview of the program. Service features. Now there's 2 key components, as I guess I briefly mentioned. The first and the most important one, I guess this is the umbrella, this is the Workplace Health Program, and as I said, that's about empowering workplace workplaces through tools, resources, support to really look at health in a very sustainable way. The second component of the program is brief health checks, which you may have heard about or have had workers complete in the past, not necessarily through the Get Healthy at Work service. These brief health checks are free and confidential for workers and provide immediate feedback on their risk of type 2 diabetes and heart disease. If they are identified at being at risk, whether they complete an online health check or face-to-face with a health practitioner, they're offered referrals to lifestyle coaching services and other health services like Quitline if they wish to quit smoking, or the GP if they need to have quite a serious discussion around how they're going to manage their risk factors for diabetes. An important and very valuable tool as part of the brief health checks for the workplace is a workplace summary report. Now, as I said, the brief health check is absolutely confidential for the worker, but at workplaces that have more than 50 workers complete a health check, they'll receive a summary report, and I'll show you that report in a moment. But more or less that's about helping the workplace identify what are the most pressing health issues of workers and really ensuring that they develop an action plan that addresses those needs. Service delivery options. Now, there was that question earlier about can government sector organisations participate in the program, and this is what I was talking about here. All New South Wales workplaces have the opportunity to register and participate in the program. However, government sector organisations aren't able to access a service provider. So government sector, for example, would do it themselves using the online tools and resources, while other workplaces may choose to access one of our 18 accredited service providers to help you with all, so they could do both the workplace health program and your face-to-face health checks, or maybe you only feel like you need their support to do health checks and not the health program. It's really up to you. As part of the registration process, you'll go in and actually make your selection there, and a service provider will be automatically allocated to you unless you already had been contacted by one of our service providers and you'd really like to work with them specifically. One of the things I would mention here is that there's a fantastic incentive to do more of the program yourself rather than use a service provider, and those things are called Get Healthy points. In summary, the more you do yourself, the more points you'll earn, and those points can be cashed in for healthy goods and services which will help you achieve your goals. So, for example, if your workplace decides to address physical activity, and part of that might be about encouraging workers to ride to work, if that's an option for them, you may consider using your Get Healthy points to purchase a bike rack. If you're looking at something like healthy eating and your kitchen's really just poorly, I guess, doesn't have a lot of, may not have a microwave or a fridge for people to bring healthy food from home, that might be some of the things that you look to do with those points. Certainly there's many, many more options, but those are just a couple of really simple examples. One thing I should mention actually before I get to this next slide is regardless of whether you choose, you request a service provider support or do it yourself, Get Healthy at Work is completely free. I guess working with a service provider, it isn't getting them to do it for you. You're certainly working hand in hand with them, but there's no cost involved. There is, though, you do have to take some time to embed this into your organisation. So another point I'd like to say, and this refers to this slide, that workplace health, there's no, I guess, not a one-size-fits-all approach, and really Get Healthy at Work has been designed with that in mind. Regardless of which industry you're in or your business size, you can really tailor the program to meet your needs. We do have specific resources that have been developed for medium and large businesses, as well as specific resources for small businesses. Obviously, the capability within those businesses can often be very different. In medium and large businesses, you'll often find HR or work health and safety people who are used to rolling out programs like this. In small business, your small business owner is typically, I guess, your champion of something like this, and they probably don't have that kind of skill and expertise or experience. So we do have specific resources for both of those business sizes. We've also developed some specific resources for 4 industries. They're looking at, I guess, primary production, construction, manufacturing, and the transport and storage industry. Now, the reason that these 4 have been prioritised is that their workers display the highest number of risk factors for chronic disease. So that's the only reason why those 4 have got specific resources. However, if you would like to better understand the health issues facing workers in your industry, it might be retail, might be health and community services, there is a fantastic website to go to, and it's called, I think it's healthyworkers.gov.au. If you go there, you'll be able to access health data on each one of those industries, just to get I guess, a feel for the types of health issues that may be facing your workers. So here's the program cycle. As you can see, it's really quite simple. Step 1 is getting the ball rolling. So that's about getting your business excited about workplace health. That's getting your leaders on board and gaining some buy-in from your workers. Step 2 is about working out your needs. I'll go into a bit more detail about that, but as you can see there, the brief health check for larger organisations can play a role there. Next up, you choose a health issue and you develop a plan. This is just about setting a goal and choosing some really simple activities under that goal of what you're going to do. Implement, you're rolling them out. Finally, you're monitoring and reviewing those activities every 6 to 12 months to get a feel for how well that, I guess, they've been accepted by the workers, whether they're sustainable, whether they're things that are appreciated or gaining results for you. So I'll take you through, and I'll try to skip through this section as quickly as possible, but this is really about just letting you know that there is so much support along the way, and really it's up to you how many resources you use, but anything that you could want, it has been developed. So about get the ball rolling, as I said, it's about getting buy-in and interest from senior leaders and involvement of workers across all the levels. At each step along the way here, there's a fantastic online training tutorial that's been developed. You can also download fact sheets, flyers, brochures, even, you know, in this section here for medium and large organisations, there's some fantastic tools to help you recruit and empower workplace health champions, because this isn't necessarily one person saying this has to be done. The most successful programs are really when there's buy-in, and particularly when you're working across perhaps many different work sites, having workplace health champions at each site will really make implementation a lot easier. Working out your needs. Here for a small organisation, this could be really quite as simple as having a chat at a toolbox talk or team meeting. For a larger organisation, we've provided a survey template that you could send out with payslips or email around the office, and if you did need to kind of report the findings of that workplace review back, there's presentation templates and reporting templates to use. The brief health check, this step is really about, I guess, communicating to your workers that the brief health check is coming and that they're invited to participate. The health check is absolutely voluntary. There's no, it's not a case of you as the business saying you must do this. It really is voluntary. What we've actually found through our pilot program, which went for about 6 months before our program launched, was that across I think we had probably about 10 businesses participate, and almost each one the number, I guess the participation level was between 30 and 40%. So in thinking about offering health checks to your workers, maybe think about set that as a bit of an expectation. In this section, as I said, it is about raising awareness of workers and inviting them to participate. So there's flyers and fact sheets, copy for an intranet, posters that you can put up around the workplace, as well as sample invitation copy. And as I mentioned, there's that workplace summary report if you have more than 50 workers complete brief health checks at an individual work site. So you've worked out your needs and you've decided that perhaps healthy eating or physical activity or smoking might be something that you choose to develop a plan. Developing a plan that's really, it's about setting a goal and choosing some actions. We've made this is the most vital step, and we've made this really easy. There's a guide to putting together a workplace health policy. There's a guide to putting together your action plan. But taking that even one step further, we've got templates for both the workplace health policy and the action plan template with examples in there that you can certainly use them to guide you or build upon them. And if you're really short on imagination, refer to the Health Actions Guide. There is it's a 12-page guide that you can order from your service provider or download it online, and there are lots and lots of ideas ranging from the very easy, low cost to implement up to something that may cost a bit of money but be very effective. So take a look at that guide, and that will really help you shape what activities you'll do in support of addressing your chosen health issue. As I said, there's 6 health focus areas: healthy eating, healthy weight, physical activity, active travel, smoking, and harmful alcohol consumption. Those are the 6, I guess, health modules that we offer that your health action plan may choose to address. And for each one of these, you can do an online training tutorial. You can access action guides, fact sheets, posters, presentations. There's so much there. I really, once you choose your health issue, take a look at those. Next up, implementation, and that's really about promoting your program to your workers and rolling it out and monitoring and your review. So as I said, every 6 to 12 months you want to keep a track of how your workplace activities are going. I wanted to give you some examples of what this might look like, because it really doesn't, you'll get to the website, and as I said, there's heaps of resources there, but this is just about choosing a health focus area, putting some measurable goals in place and choosing some activities. So here's an example. One of our pilot program participants was a truck depot. Now they chose to focus on healthy eating, and their goal was to increase the number of workers who made healthy food choices throughout the workday. They looked at, and our materials really suggest that you look at activities focusing on people, places and policy. So from a people's perspective, they said that we'd provide information and education for drivers around food for better health and how to eat healthy on the road. A really interesting thing they did there actually was they looked at the truck stops that their drivers normally stopped at and looked at the menus there and identified for the workers which was the healthiest option out of those menus. So look, it still is about personal choice, going in and choosing what you want, but if a worker does want support to make healthier food choices, it can be really confusing, and that was something that the workers really appreciated and was really quite simple for the workplace to do. Healthy places, so they said, look, we're going to provide access to drinking water, cold drinking water, and we're going to encourage workers to use refillable water bottles while they're out on the road and around the depot. They also said that we'd provide kitchen facilities to encourage on-site workers to bring lunch from home. And finally, healthy policy, some of the things that they put in their healthy workplace policy looked at worksite vending machines and the types of foods that they would have in those vending machines, and when they catered at work events, what were the type of foods that they would cater in that, and they built that into their policy. Another example, this one was an office environment, and they wanted to increase the number of workers who use active transport, so that's walking to work, it could be cycling to work, it could even be using public transport, but there's a lot of incidental exercise or physical activity involved in catching public transport at times. So this office environment said that one of the things they were going to do to get people feeling more confident about riding to work is that they'd provide a subsidised cycling program for new cyclists after work in the park across the road. About the healthy place, they'd provide secure bike racks and improve their change room facilities. And they also looked at flexible work hours to support workers safely cycling or walking to work. So that actually meant for some of them not cycling or walking in the heat of the day, or not cycling or walking during the dark of the night. Finally, they just put those kind of activities in a healthy workplace policy, which really just formalised their commitment to help workers actively travel to and from work. So are you ready to get healthy? I hope so. Look, to get started, all you need to do is visit the Get Healthy at Work website, have your ABN ready, know how many workers your organisation employs in New South Wales and how many work sites it operates in New South Wales. You'll go through, and I'll show you this in a moment, you'll activate your account, then read the first time new user guide, which really gives you very important instructions for how to get started. Next up, you'll select your preferred delivery options. So that's about choosing whether you'd like a service provider to support you with your workplace health program and health checks, or whether you're happy to do it yourself. Next up, you'll complete the initial online training tutorials. You don't need to do them all, but there's really a couple that will really help you get a better feel for the program and how your organisation might like to adopt it. Then you'll get the ball rolling. Step 1 of the program, you can access those resources on the website, and before you know it, you'll be creating your first workplace health program. So at this point, I'll give you a short website demonstration before I answer a few more questions. We're tracking quite well for time, which is very good for me. So let me go to our website. So this is the Get Healthy at Work website, and this is just the front end of it. The web address is gethealthyatwork.com.au. As you can see here, there's some information for workers, there's some information for businesses, and this is where you'll be able to view some of those videos if you're interested in taking a look. There's also some general information here. You can get a feel for some of the health focus area resources that will be made available for you. You can access them here, but you'll have access to them again once you log in. One thing I will note to you before I demonstrate a registration, if you are curious about the brief health check, you can visit this page for more information. So this is the brief health check page of the website. You'll see here a bit more information about it, but you can also take a demonstration of the online health check. So you can see it there, and look, it's exactly the same as what will be offered to workers if you choose online, or even if you choose face-to-face. You could still have some workers, perhaps those sitting in an office environment, you may still select them for a online health check. So again, I just invite you to go there and take a look if you have any questions, curiosity, concerns about the brief health check. So let me take you through the registration process. Let's say I run an antiques business. Really in there you should type in your business name or your ABN if you have it, but I'm just going to do a test registration now. What it does when you type in your ABN here, it actually is connected to the ABN lookup tool with, I can't think what the organisation is, but here you'll be able to see, you'll be listed here, and you'll just select that that's your business. If we'll say Abbott's Antiques is my business for today, we'll proceed to the next step. Here it is, it says that's my entity name, just making sure you are who you are. It says, how many workers does your business have? Now, it's very important if you are a national organisation that you only enter your New South Wales number here, because that's the workers that this service will be able to access, or other way around. So let's say I'm a medium business. I've got 55 employees across 3 work sites. Again, what I'd like to say to you here, whatever numbers you put in here can't be expanded on at a later date, unfortunately. So if your business is likely to grow, or if you'd like more workers to participate within New South Wales in the future, just enter the highest number, that your highest estimate, before you press forward, because if you do enter that you've got 3 work sites here and at a later date you'd like for your 4th work site to now participate in the program, unfortunately we can't, the system doesn't allow you to add more work sites, so keep that in mind. So yes, this is my business. We'll say it's me. Type in an email address. It's all pretty self-explanatory. No surprises. Proceed to next step. So right now it's saying, great, I'm going to send you an email, so you need to activate your account. This is pretty common. I'll then go to my Gmail account. Here's my registration information, my activation email. Click on the link. You've only got 48 hours to do that. And it takes you into the next, I guess, step of the registration process. So in this section, you'll learn more about the Get Healthy at Work program, but if you don't have time to read that all now, you can skip through it because you will again be able to access that information later. But if you do, by all means, take a look at that content. This next slide here is about telling you about the program options. So you can see there, this is when you select whether you'd like a service provider or whether you'd like to do it yourself. And it gives you some pros and cons about choosing which option it is. Now I do want to just highlight here that it's actually not at this stage that you select your service bundle or your service delivery option. You do that once you've completed activating your account. So we'll go to the next step. And finally, it'll now ask us, and this is quite important, to add a worksite, and you could add up to 5 here. Once you go through to the business portal, you can add, I think it's up to 50 or possibly even more, but I know there certainly is basically no limit on it. So at this point, we'll just add one worksite. We'll call this, let's say I'm at Padstow. Again, some businesses have contacted us when they've had issues with this section. Again, the address is verified against any address that that's registered with Australia Post. It's not necessarily saying whether you exist there or not, but if you're entering your physical street address and it's not working, try your post office box address because, as I said, it's what Australia Post has on record of being actual addresses that mail is delivered to within New South Wales. So at this site, we'll say we've got 21 of our workers, and I'm going to be the contact person there. You'd actually, for your example, type in the actual contact person. What you're typing in here is the person at that work site, and it could be yourself if you'll be managing the health checks there, but more or less the email address that you put in here when you decide to fire off your online health checks, they'll be the person that receives that email and will be responsible for forwarding that on to workers on that site. So let's enter one here. Add worksite to list. Now, as you can see there, Padstow, it's in Liverpool, 21 workers. I can modify it, and I can even add more worksites. But at this point in time, I'm going to go to the next step. I'm going to say I heard about it via webinar. And I don't have workers that speak a language other than English. I would like to say that if you do have workers that speak languages other than English, we do have some of our resources that have been translated into traditional and simplified Chinese, Arabic and Vietnamese. And for the health check, if you do require an interpreter, a service provider will be able to assist you in finding an interpreter to support that process. So next, success, your account is now activated. Now importantly it says here, go to your account now to select the service delivery option. So great, take me to my account. And this is where you're going to be managing your workplace health program. As I said, once you arrive, you'll see here, you can click on any one of these steps here to go to resources for that part of the program. So get the ball rolling, for example. There's some content there as well as the resources that you'll access down the side. But what I'd always recommend you do when you land, just go to the first time guide here, which I'm highlighting, and go to the 5-step new user guide. That'll give you instruction for how to get started. As I said, it's about completing the online training, deciding whether you want a service provider to help you or not, but first you need to finalise your worksite, and then creating your first workplace health program. So if you are new to the program, please go to this tab first. What you'll also find here is some more information about those delivery options, and as you can see, some benefits and pros and cons of those. And at this section here is where you'll select a delivery option. So I've decided that I'm going to do the workplace health program myself because I can see everything there's for me, but I would really like to offer some of my workers face-to-face health checks. And I also understand that I can still do online. At that point, it'll calculate my incentive score. So it's giving me 10,800 Get Healthy points. Yes, I'm the authorised representative. I have a service provider I'd like to use. So as I said, we've got 18 service providers, and they may have provided you with a service provider ID code. If they have, type that in there. Otherwise, choose auto allocation, and what will happen is that one of our 18 service providers will get an email alert. It'll tell them your business name, the size of your business, where you're located, and your contact details, and they'll be in touch with you to confirm that they've accepted your work and to start working together. So, so you can finish that process. Another thing I'll show you here is the report. As I said, there's a workplace summary report where work sites that have more than 50 workers complete health checks at that site will receive a report that really guides them in prioritising a health issue for their plan. And if you just click here, you're able to see an example. So as you can see here, the snapshot of your workplace. Now this workplace, this is purely a test. It said we had 50 work sites. They had 50 workers complete their checks by the 16th of August. And here you can see that 38% of workers were low risk for diabetes, 19% were high, 36% currently smoke, 91% don't eat enough vegetables, and I'm one of those, and 13% don't exercise enough. So it goes into more detail about each one of those, but again, a really valuable tool for helping you work out which health issue to focus on, but also report back to your organisation if that's something that you need to do. I'll also show you in here, again, often just because we get a lot of questions on this, is if you've chosen online health checks, how do I go about initiating that process, getting it underway? So here we'll write in that the worksite name, which was PADSTO as I'd called it, worksite information there, and you can track how many of your workers have completed the health check. So at the moment I haven't sent anyone an email, so 0 from 21 have completed. But to generate the health check email that'll go to that worksite coordinator, who happens to be me in this example, I would just press proceed and they would receive the email. If you choose to do face-to-face health checks, your service provider will work with you to decide on some dates and some time slots, and they'll then provide you with a, you'll go to complete health check booking here, and this area here will be populated with dates and times, and then it's your responsibility to add worker names to each one of those days and times. Finally, I'll just show you the Resources tab. So while you can access resources through clicking on any step of the program cycle here, or going to Health Program Information, or clicking on the left-hand navigation bar here, you can also access some other resources here. So that includes accessing the training tutorials, those health focus area resources, and this button here, Get Help with My Health Program. If you do decide to do it yourself and at a later stage during your first program cycle you decide you'd like some help, you can always upgrade your options here. Finally, I'll just show you settings. This is where you'll go to add more work sites, manage users. So at the moment, if you register your business, you become the business administrator, so you've got the most amount of control and rights over this. But for larger organisations or even medium-sized businesses that would like to have some other people accessing those resources and rolling out the program, you can make them business users just by creating a new user account. So I'm here with my colleague today, Samantha. And I'm going to make her a business user. So I'd put in her email, save user, and she would then get an email that invites her to come and set up her login information and then be able to access all the resources that you need to roll out the health program, but not change any of your settings. So not directly delete or add work sites or change passwords or anything like that. So again, just that's really handy if you are looking at getting more people to assist you in rolling this program out. At this point in time, I think I'll stop because there's probably more than enough information that you've been given. Before we go on, Samantha, are there any questions that anyone has?
Okay, so we've got a question here from Annie Curtis who's asked, can government companies get the summary statistics from the online health checks?
Absolutely.
Absolutely. Any organisation that has 50 or more workers complete health checks at a single work site. So that's at one work site that's been registered. As soon as you have 50 or more complete health checks, you'll become eligible for that, and you'll be able to select that work site from the drop-down.
We are looking to
extend the summary report to be offered to any organisation that has 50 or more health checks completed across multiple work sites, or even compile all the data from those multiple work sites, but that's probably about a month away at the moment.
Okay, Nicole Mitchell has asked, does a service provider come to the workplace or are staff required to attend a clinic?
Great question.
Great question. The service provider in most instances will come to the workplace.
At all times
For a face-to-face health check, they will be at the workplace. For some, I guess, remote workplaces that the service provider is only supporting with the workplace health program, they may actually consult with you over the phone. But the idea is that any health checks would be completed. They just take 15 minutes, and if you choose a service provider, they'll be completed on-site with that health practitioner.
Okay, next we have Stuart Connor who has asked about how do you earn points?
Sure, the
Get Healthy points.
You earn them.
I guess there's a sliding scale. So what you saw was that because I'd selected face-to-face health checks, I got, although I said I'd do the workplace health program myself, I got 10,800 points. Now if I chose to do the program myself, so online health checks, and workplace health program, I'd get more points. If I decided I wanted the service provider to help me with everything, I'd get less. But how you become eligible for them is that you must progress through the Get Healthy at Work program up to the point of developing an action plan, and you must have around, I think at the moment we're looking at more than 30%, or could even check, I would have to check, but more than 30% of the workers. At that point you become eligible to claim your Get Healthy points, and someone from the Get Healthy at Work team will then be in touch with you to discuss how much they're worth and give you some ideas based on your action plan on things that you'd like to spend those points on.
Okay, we have a really good question here from Peter who has asked, he said, we are a national employer. Can we provide the program to all employees, including employees in other states?
We get this question.
We get this question all the time.
You can certainly roll out
the workplace health program to work sites in other states. However, you're not able to register these work sites on our website. That really shouldn't make that really shouldn't stop you in terms of using the training, the resources, the tools, the templates to develop that workplace health program and then roll it out. What we are unable to do is offer health checks to workers in other states, whether they be online or face-to-face. So I guess in summary, a service provider can't assist you with interstate workers, and we can't offer health checks to interstate workers. However, you can certainly use the resources on the website to develop a goal, to put some activities in place, and use the advice to then implement, monitor and review your program.
Okay, and one last question. Juliet has asked how long the Get Healthy at Work program is available for.
Sure.
Sure.
Get Healthy at Work.
Get Healthy at Work launched on the 1st of July 2014, and at this point it is that is a 2-year program. So up until the 30th of June 2016, this website, all the tools and resources will still be available, and actually I believe the website will be available for an additional 2 years after that program cut off date, but really it'll be determined by how successful it is. If certainly we're overwhelmed with business interests, there'll be really fantastic grounds to keep it going, but at this point it is a 2-year service.
Okay, so
I'll move on. Thanks for those questions. So finally, I'll just wrap up here by just summarising what the workplace health program looks like. So for small workplaces or those that really just want to take a shortcut approach to this, I'd just like to simplify. It's just about discussing the idea at a team meeting and asking for some feedback on which health issue to focus on. It could be, you know, do you want to eat healthier food? Would you like some help to quit smoking? Would you like our workplace to really enable you to be more physically active? You'll choose one of those health focus areas and you'll set a goal. Next, you'll choose some activities. You'll just go to the actions booklet perhaps and choose some of those activities, or maybe come up with your own. But it's more about, I guess, formalising your commitment to those by writing them down. Next, try to aim to have 50% of your workers complete health checks. As I said, it's around 30 to 40% in our test businesses, our pilot program, but particularly if you're looking at a combination of online and face-to-face, 50% really should be achievable. Next up, you'll redeem your Get Healthy points, and then monitor and review your actions every 6 to 12 months. It really is quite simple. Recommended approach for large organisations. It can be a bit more complex for large organisations, particularly if you've got to roll out a program across multiple work sites, and even at those work sites you might choose to address healthy eating at one, you might look at smoking at another. You can actually really break it down and deliver a workplace health program that's quite specific to that work site, and our website certainly enables you to do that. Look, gaining your leadership commitment obviously takes a little bit more time in a large organisation, but having said that, a lot of large organisations are quite on board with wellness already. You'd really utilise your workplace health champions to take responsibility for the program at their work site, their office, their division, their faculty, however your organisation is structured. And I'd really recommend just targeting the highest priority health issue at each site. Or you could focus on the same health issue across all sites. It's really up to you. An easy start, you might look to pilot the program at one site first, get a feel for it, work with a service provider to help you get that first program up and running. Just target one health focus area. By all means, you can target more than one, but if you're just trying to ease your way into this, just look at one health focus area to start out with, and then roll the program out to subsequent sites once you're feeling confident. By all means, large organisations who are considering registering, contact our team. I'll give you some contact details shortly, and we'll be able to really assist you in what's going to, we think, work best for your unique case. So finally, I've really answered some questions, but we'd always invite you to ask more. What you can do, if you'd like to order a workplace information kit, email us at ghawfeedback@workcover.nsw.gov.au. If you've got more questions or you'd like some registration support, hit us at that email address or complete the feedback form on the Get Healthy at Work website or call us on 13 10 50. You'll reach, that's the WorkCover New South Wales Customer Service Centre, and they'll forward your call through to our team. Finally, connect with us on social media. We have a LinkedIn page. It's quite new, but please join us. You'll also find us on Twitter, and you can view our videos on YouTube. So, look, I hope you're excited about workplace health and you're ready to make it your business's New Year's resolution. Certainly, it's a really fantastic time to be talking about health. January is when we're all thinking about healthy eating, losing weight, being more physically active, quitting smoking, really rethinking how much alcohol we drink after Christmas and New Year's, and it's a fantastic time to demonstrate to your workers that you're there to support them. Look, register online at the website, and I hope you'll be getting healthy in 2015. Thank you so much for your questions, and we'll speak with you again.